Are you a recent graduate or just beginning your career in global health? Then this is the perfect time for you to develop your personal impact story, because your story matters and you can change anything you touch. So start with conserving and preserving your precious mental energy and guard it against depletion. Boost your self-care, take it beyond the workouts and the walking groups and the Zumba classes and other good things that you're doing. Simple focus, like simple selective focus and a deliberate practice to develop your personal impact as a global leader is the best thing that you can do for your career right now. I'm Zari Gill, and I'm a global health consultant and a coach. And my stories for change and personal impact development come from the people I meet, from the communities I serve, and the experiences I've gained over the last 25 years in 30 countries across the world. I wanted to become a physician since my high school days, and I got a training as a pediatrician. But when I started to work, I saw that young children, like really young ones, were dying untimely deaths just because they were not immunized at the right time and they did not receive the timely and accurate interventions for conditions like pneumonia and diarrhea. So the pressing need for primary health care and the urgent requirement for timely and prompt and accurate interventions is what led me towards the career in public health. I acquired a master's degree from Johns Hopkins University in Baltimore. And it was a memorable time because we were the top talent across the world put together with a stellar faculty. So we did not only learn from what the school had to teach us, but we were enriched and grew from what we learned from each other. And that has continued up to this day. I continue to study and learn from the trends and the evidence-based findings that are being produced by many of my colleagues on a regular basis. So I've been in public health most of my career. I started as a project manager of a small child survival project. And as the scope and the need for the work grew, it took me on a path to serve in 30 different countries across the world. So I've worked as a project manager at national levels up to global leadership, for healthcare and health teams. The most important thing that I learned is my passion for developing and advancing women. I saw and I witnessed that when women are developed and endowed and empowered, they can bring transformation, real transformation in lives of their families and the communities. So global health has been an evolving sector since always. It's been changing and evolving and becoming better. We used to call it international health just a generation ago, and now it is referred to as global health. Because we know that health as a concern is not limited by national boundaries anymore. We've also learned a hard lesson. I learned it the hard way, I must say, that the health of the worst cared for across the remote communities affects us all the same across the globe. The biggest change that we have seen is the change in work life over the last 1 year. Many jobs were upended. The remote work has become normalized and it has replaced the 3 to 5 office-centric work. Travel industry has been decimated, and these things have a huge impact on the way we are going to do global health and bring global development to the people who need it most. The pandemic has reversed the progress that was made, and it has put almost like 25 years behind. We now see that almost 40 million people across the world have been pushed back into poverty, and they face a daily challenge for healthcare and their personal well-being. So my dear folks, health sector has to change again. Health sector has to evolve. We need a hybrid model for working and bringing help and assistance and global development to the people who really need it. We need disruptive thinking to change the health systems so that we can promise better health outcomes. We need and are totally dependent on young leaders who understand the interlinkages between the SDGs and the health outcomes, who can change and undo the things that have not been working and bring in new thinking and new methods and new approaches.